My name's Gary McElvain. Let me welcome you to HS 222, First Aid and Emergency Care at Marshall University. This is a course I think everyone should have. Everyone should have it in, I would say even high school, also in college. It's one that pertains to us whether we're in the field of healthcare, whether we're a healthcare provider, whether we're at home, or out on a trip, at a park, at church services, some kind of religious activity, whatever it may be, somebody's going to get hurt there, and first aid is going to get done. So what I want to think about, a couple comics on here. You have this PowerPoint, first of all. The PowerPoint that you have is annotated, so there's a lot of text added to it. The one I'll be using here won't be annotated. I'll be saying it instead. So that way you could watch this and listen to it. You could print off the annotated PowerPoint and add anything else to it that you would like from the whatever little bit of lecture or from your readings in the text to be able to supplement that. When we think about first aid, it could be everything from the child in the bottom left-hand corner whose parents buy them the car and take them home. They leave it somewhere. You're walking through the house at night, you trip over and fall. Or you're walking through the house at night and you don't have the lights on, and you ever done this and catch your toe on an end stand or a coffee table and break your toe or injure your toe in some way. Trip and fall up steps, trip and fall down steps, trip and injure yourself when you're trying to ride or when you're trying to play a sport or anything like that. So there's a lot of different things that first aid happens in. And what I want to look at is when we think about first aid, and you think about the world, I'm an athletic trainer, and I work in the world of sport most of the time. So obviously we have injuries of collision on what's your picture you're looking on the left, injury collision in the outfield in baseball. It can happen, people lying unconscious after the injury. So you have multiple things going on. There's this thing we call triage, and finding out how many people are injured, who is the most injured, and who should I go to and help first. That's a very important thing when we think about triage, is who seems to be the most injured, who needs first immediate care. If you walk onto a scene and somebody's lying there holding their elbow on the ground and they're screaming at you because they're in pain, and then there's someone else lying not too far from them motionless and appear to be unconscious, well, the person that's unconscious and motionless is the one in most need, even though this person's screaming at the top of their lungs. So when we think about first aid, one of the first things you want to think about is, well, what setting might I be using first aid in? We have protective gear, the top center, in baseball, but at the same time, injuries can happen even with protective gear. Whether it be football, baseball, soccer, any sport you play, any activity you do, whether it's a family reunion, whether it's a backyard time with the kids, and you're just out there playing and having fun. You can step in a hole, sprain your ankle, even fracture your lower leg. So many things that can happen there. We can also think at the pool. People doing things off the diving board in the pool can present a danger. Eye injuries, don't let looks deceive you. This eye injury may not be as bad as it looks. Sometimes things look a whole lot worse than what they actually are. In that bottom picture of the ankle, the typical sprained ankle. I know a lot of you may have sprained an ankle before, and that first time you do it, the pain is unbelievable. And then if you sprain it after that, yes, it hurts, but it's not like that first time you did. You can learn to tolerate that pain some. And then we think about the playground. That left picture, this would be, it's not my son, but that would be him on the playground. He's going to turn 4 soon, and he would be the one hanging upside down and ready to fall on his head. If someone could fall and scrape themselves up pretty good, standing on the tire swing, doing things they probably shouldn't be doing. That's the typical boys and girls these days, is that they play. Leave them alone in the room, sibling's room. They're climbing on the crib. The sibling is in there, and he's okay, or she's okay, the sibling, but the big sister is climbing out, and the injuries that can happen there. Take a look at this picture. You see the dots on his nose, you see him pointing his nose, I hurt my nose, I hurt my nose. Well, this is the reason why we don't run with sharp objects. This picture, again, is also having, if you can't see it well in the video, you have this PowerPoint, but there's a fork stuck right here in the cartilage in his nose. We never pull anything back out when it's impaled. We leave it. And that's part of first aid and being ready and able to be calm as a mother, as a friend, as a parent, or even just as a bystander to be able to say, hey, wait a second, here's what we need to do. This is the proper action that's going to have the best results. When I was working on my master's degree outside of Nashville, Tennessee, I was driving from Nashville out to Murfreesboro to Middle Tennessee State University, where I was going at the time, and this was a wreck that happened right before I drove up on this wreck. I was driving the opposite way of all this, so I would have been over on the other side of these trees going the other direction. But what happened was this tractor and trailer you see on your left drove through stopped traffic on 60 mile an hour. There was construction going on and just drove right into the traffic. 3 people had to be life flighted that day. Luckily, and I think it's this gentleman, but I can't remember for sure if that's him or not, but he was coming up on the scene at the same time. He was heading into Nashville. He was behind the wreck. And he was the assistant medical director of Vanderbilt University, one of 2 people that could authorize life flight. So I think several people were very lucky that day that he happened to be one of those people that was there on the scene initially. Several nurses that was on their way to work into Nashville got caught behind the wreck and came up and helped. So as EMS arrived and they took over the scene, there was a lot of people providing first aid with a lot of different backgrounds. Nursing. He was a director of medical services at a major hospital in Nashville. I'm an athletic trainer to provide emergency care and care of injuries to athletes and the active population. So we had a diverse population here. So one of the first things you need to do is identify yourself and the level of training you have. That way people know who you are and what you're able to do, and we can work as a team to help those that need help without knowing each other from the beginning. So when we think of first aid, one of the first things you want to think about is, what is first aid? Now you've had a discussion question on this. If you haven't completed that discussion question yet, stop the camera now. So stop your video player, go back and do that discussion of what is first aid. Answer those questions in the discussion question. Read what some of the others are saying and kind of postulate what you think first aid is. So pause if you haven't went and done that yet. Go back and do it. Don't watch any further until you do that. So I take it that if you're still here watching right now, you have done that discussion question, what is first aid? If you think of the definition of first aid, this is what it boils down to. Immediate and temporary care. Most people would get that. It's immediate care for someone until they get to the hospital. Immediate and temporary care until a more qualified or equally qualified person takes over. So immediate and temporary care until an equally qualified or a more qualified person takes over. So if I come up on a scene and I start giving care, I'm expected to continue to give care within my scope of practice as a first aider until another first aider takes over, or someone with more higher qualifications, such as someone with further training than just first aid. The athletic trainer, the nurse, the physician's assistant, the physical therapist has further training. Also the physician, the MD, DO, chiropractor. You look at so many different people in the world today that have these different things, that different higher degrees that can come in and help. And we need to be able to realize, hey, this person is well trained, and when they take over a situation, then I'll just help them with what they're doing. So when we think about first aid, it's that immediate and temporary care until that more qualified person or equally qualified person takes over. So hopefully what you'll get out of this course is the idea of, I want to be able to help people. I want to be able to take care of situations at home, in my job. Maybe it's part of your job to offer first aid, and it takes on a little bit different meaning when you think of liability issues. When you get to that part of the PowerPoints and the content of this course, you have to think about what's part of my duty and what am I volunteering to do. And that kind of separates some of the things that we'll talk about. When we think about first aid, that immediate and temporary care, one of the groups of people we want to get there is EMS to help out. Maybe it's firefighters also, if they have to cut someone out of a car. Most of the time, many times, firefighters are cross-trained as EMTs. and they will give whoever's closest gets there first, and the EMT and or paramedic will be there right after to take over that medical care once they get there. So when we think about if you have an emergency situation happen and a fire truck pulls up when you call 911, watch the video on the emergency action planning. I won't talk much about it here, but do go back and watch that video. It's in depth. It has all the information you need on your assignment, as well as things to consider for an emergency action plan. But if that firefighter shows up first in a big heavy fire truck with a ladder on it, and you call for an ambulance, don't be alarmed. They're cross-trained as EMTs now, and they will begin that render care until the ambulance arrives. So that's all I'll say about the emergency action plan at this point. But what I want you to go back and watch that video and look at the notes and the annotated information in the PowerPoint that's provided also for that assignment, because you will have to create an emergency action plan. One of the things to think about is the emergency scene. When we say the emergency scene, we have to consider what all is going on. And what I want to do at this point, I'm going to turn the light on so you can see better, and turn the PowerPoint off so I can have more board space to be able to write. But what we want to do is to be able to take care of a scene until EMS or someone else arrives. So when we think about the emergency situation, the number one thing to consider, the very first thing, and it goes back to an adage that if you're not part of the solution, you're part of what? The problem. You're not part of the solution, you're part of the problem. So know your limitations in an emergency scene. If I do not like the sight of blood and I'm going to pass out at the sight of blood, I need to be the one that goes and calls EMS and gets EMS to where it goes. Somebody else take care of that scene. Respect each other's dislikes and things that each other can't handle. Because that's an important thing to realize, is not all of us do good in situations that's good as someone else would do. Some of us may do very poorly in certain situations. But as your ground situations become, in these different emergency scenes, you become more used to them. Some of the things that used to bother you may not bother you anymore. And that would be I guess a progression for you in what you can handle and what you can do in an emergency situation. The very first step we want to look at is what we call survey the scene. So when we say survey the scene, it's really, we're going to look around. We're going to look, see what's going on, see who's involved, and what we're going to do is, number one, is it safe for me to enter that scene, first of all? Because if it's unsafe for me to enter and I'm going to become part of the scene, if I enter the scene, then why am I doing it? Because now I'm part of this, now I'm part of the problem and not part of the solution. So is it safe for me to enter? So one, A, for me, and B, is it safe for the victim or victims? Because if there is a car wreck and someone is in a car and it's starting to smoke, then you see flames, well, it's probably not safe for you, and it's definitely not safe for them. But are you going to make a decision to go into that scene and help them and try to remove them from that situation? But if it's safe for us to go in, then the next thing we want to think is triage. How many people are involved? What's the extent of the injuries to each person? Because once we start to render care to someone, we need to stay there and render care until someone else takes over. So don't begin rendering care to someone until you know who you really need to get to and who should be dealt with first. And that comes from taking in what's going on. Is there someone lying motionless? Or is everyone conscious and you're able to talk to each one before you start doing anything? The picture of the wreck of the tractor and trailer that went through stopped traffic. When I was going up on the scene, the other person that was going up on the scene, I looked at him and said, I'm an athletic trainer. I provide emergency care and treatment of injuries to athletes. And he said, I am the assistant medical director at Vanderbilt University, And I said, okay, what I will do is, when he said that, I understood that he has a decently high position. He was on the phone calling for life flight, helicopter life flight at the time, when as we was walking up. And what I told him is, I'm going to go take a quick survey and I'll come back and tell you what all is going on before I start doing anything. Because I knew once I started doing something for someone, I couldn't go tell him, hey, we've got these other 2 situations over here that may be worse than the gentleman that truck was sitting on top of his car. He was critical, but there was also 2 other critical people. One was a mother in a car, and the other was a child that was ejected onto the interstate. All 3 people lived, luckily, and it wasn't anything great or anything of grandeur that we did. We remained calm, and we got the right people there and the right equipment there to be able to provide the care and get those that needed to the emergency room, and that's what saved their lives that day. The EMTs and the paramedics, we was part of that, but we wasn't the ones that actually say, hey, we did this for this person and we got their heart beating again. No, that wasn't us. That was the EMTs and the paramedics and some other people that was helping out. So when we think triage is how many people, what's going on. And when I gave that report, I said, I'm going to go over here and help this person. By that time, there was about 5 or 6 ambulances there to be able to help. And I just told them where things were going on. They went to the most critical, and I went to a much lesser critical until, really a non-critical, until others got there, other EMS got there that could take over for everyone. So once as the EMTs came in, they took over the most critical because they do it every day. As an athletic trainer, yes, I can provide care. I can stabilize someone, help put them on a backboard. But when people do it every day like that, in a situation like that, I'm there to help them any way I can. I'm not there to hinder them. So surveying the scene. So I'm calm. It's safe for me to enter. I realize who I need to help. So my next step is the primary survey. This primary survey is when I come to someone and they appear to be unconscious, these are the steps we're going to go through. So the very first thing in the primary survey, I look for responsiveness. Is the victim responsive? If they are responsive, yes, they talk to me. They are conscious and breathing. If they are conscious and breathing, so they say they talk to me, I hear some kind of sound, they look at me and make a sound, whatever it is, they tell me, then I go to the secondary survey. Which we'll come back to in a second. But if they are not conscious or not breathing, then we have to go down this route, and that is C, A, B, and I'll add a D down here at the bottom. But typically, the C, A, B is what we look at most of the time now. When we think of, here's what we need to sustain life for someone. When you watch the videos on CPR, this is the order it's done in. Circulation. If there's no pulse, they start compressions. Depending on whether it's 1 or 2 rescuer, whether they start with 30 compressions or 15. Run rescuer, it's always 30 compressions. And then while they're doing this assessment, they look for signs of life. If there's no signs of life, they're blue around the lips, the blue fingertips, they don't get a pulse. They take the carotid pulse on the adult, and we take it less than 10 seconds, about 8 seconds, 7, 8, 9 seconds. There's no pulse. They say, okay, I'm open the airway, head tilt, chin lift. I'm going to give 2 breaths right after I do the compressions. So it's, is there a pulse? If no, 30 compressions. Open airway. Once the airway is open, give 2 breaths and back to this. Now if we have a D, what the D is for is defibrillator. An automated external defibrillator. When you get to the CPR part, you will watch videos on the automated external defibrillator. And when you go to get your certification card, it has to be first aid and AED, automated external defibrillator. So when we say CAB, we're in the primary survey. We're saying somebody is either not responsive or they're not breathing. Because if they are conscious and breathing, then we're going to go over into our secondary survey. But if not, then we say, okay, check pulse. If no pulse, 30 compressions. After 30 compressions, open the airway, give 2 breaths, and we keep in that cycle. And we'll talk a whole lot more about this when we get to the section on CPR. So we're kind of going to skip over that part for now, and we'll come back to it. The other part is what we call secondary survey. The secondary survey has 2 things. One is something we call sample, which is an acronym. You have this again in your PowerPoint. If you print it out, you know what it is. The first thing is signs and symptoms. A sign is something you see. Think of a stop sign, a billboard sign, anything. Sign is something you can see. I take a pulse, that's a sign. I write it down. Those are signs. If I count how many times they're breathing, that's a sign. Symptom is something they tell me. I have a headache. I feel like I'm going to be sick. I'm nauseous. I feel dizzy. That's a symptom. So a sign, something we see. Symptom is something we're told. So look for signs and symptoms. Ask them, do you feel okay? We're in the secondary survey. So they're conscious and breathing. We start asking them these questions. How do you feel? What happened? All these different questions. And then signs. Is there torn clothing? Is there bleeding? Does it look like there's an extra joint about mid-forearms? Maybe they fell on an outstretched arm and caught themselves. And then we have to know, do you have any allergies? Because maybe it's the allergy that caused the problem. Maybe it's a severe allergy and they get into anaphylactic shock where they have to use an EpiPen. Or it's an allergy that's causing them to wheeze and sneeze and all kinds of other things, and that's part of it. Maybe they're allergic to a certain kind of medication, and we need to be able to report that when we hand them off to EMS or whoever it is we're handing them off to as a first aider. Because remember, the definition, immediate and temporary care until a more qualified or equally qualified person takes over. So we're not giving medical advice, we're giving treatment for an injury that's within the scope of first aid. You practice as a first aider would practice. And that's the things in this course that you will learn is what does a first aider do? What's appropriate, what's not appropriate. Are you taking any medications? Maybe it was a medication that caused it. Maybe it was a medication they did not take. Their own blood pressure medication, they didn't take it that morning. And now they're having problems. I had a high school football coach. We're at halftime of a game on Friday night. He come out of the locker room, and he falls against the wall basically outside the locker room. And leaning against it, you can tell he's pale, he's sweating, and it's cold out. I've got 3 or 4 layers on. I'm not one that gets cold easy. And he goes, I just don't feel good. Something's just not right. So the more questions I ask, the more I start finding out and asking about medications. Well, yeah, I'm supposed I'm supposed to be on a blood pressure medication, but it makes me a little bit dizzy, so I didn't take it. I quit taking it 3 days ago. He's complaining of his left arm is numb, and he feels chest pressure, and he's lightheaded, and he's sweating bullets. I take his blood pressure, and his blood pressure was something like 210 over 130, I believe, somewhere around that area, and that's extremely high when you think of your average of 120 over 80. That's that magical average. We'll talk about, in this course, always think about ranges. Do you fall within a range? And he was well above the range that we're happy with when we think of, is there something going wrong when we look at vital ranges. So, is there a medication they took that may have caused the problem, or is there medication they didn't take that they're supposed to take? Either one could be a problem. Previous illness or injury. Has this ever happened before? Maybe they're diabetic and they hadn't eaten yet that day. And they get lightheaded and about pass out. There's all kinds of things that can happen. But has this ever happened before? If so, when? What was done for it? Did you see a doctor? What they say it was? Try to get that information. And then last, oral intake right with that. Because if they hadn't eaten all day and hadn't drank anything, and it's 6 o'clock in the evening, and maybe they had dinner at 6 o'clock the day before. It's been 24 hours since they've done anything. And if it's like a day outside today, it's 90 degrees outside, sunny, not a lot of wind, and people aren't really used to the heat yet since we're just starting to get into the summer. It's about May right now here in Huntington. May 30th is today. So what was the last oral intake? Fluid and food, because maybe they're dehydrated and they're starting to get lethargic and getting the heat exhaustion. So many different things. What we have to do is take all this information we're gathering, and we have to put the pieces of the puzzle together. What's going on? The last thing, the events leading up to the injury. What happened? What was going on? Do you remember anything? While we're doing this, we have this thing we call a head to toe, head to toe evaluation. So while we're gathering this information, we're going to start at their head. And we're going to look and palpate, see if there's pain. Is there any pain on their head and skull? If not, then we move to their neck. Do they have any pain in their C-spine, especially right along the cervical vertebrae, the C-spine? The spinous process is a little stick out on the back of the neck. If there is pain somewhere, we want to note that, because as you go through this course, we'll learn what some of that pain may be and what we may need to do from that. Do they have any pain on the front of the throat? Be careful how hard you push. Then start on the chest, and then abdomen. Is there any pain? Do both sides feel the same? Then low back. Can you get into low back along the lumbar vertebrae? Is there any pain? If not, don't worry about the low back. And then I would move to their legs. Move down their legs, each leg, and see is there any pain. Then come back and do the arms. Some may do the arms as they're going down, and that's fine if you do. But typically I like to go to the legs first, because if the leg is injured, the femoral artery is about the size of your thumb. Your femoral artery is. And bleeding out can happen a whole lot more, a lot quicker there, and the possibilities is more there than it would be if the brachial artery in your upper arm was severed and was bleeding. You would have more of a chance of bleeding out and dying if it's lower extremity. So when we think about this whole process of survey the scene, is it safe for me to enter? Is it safe for the victims that's there? The other thing we have to consider is triage. How many people? What's wrong? Primary survey. Is the victim or are the victims conscious and breathing? If they're all conscious and breathing, we come over here to the secondary survey. If there's someone not conscious, we start here. We check responsiveness. If no, we start down to CAB. Circulation, airway, breathing, and possibly defibrillation. We'll come back to that when we do CPR and rescue breathing and the AED. And then if they are conscious and breathing, we're over here. We're going through this acronym called SAMPLE, right here. And with this acronym, we want to consider, are there signs and symptoms? Do they have allergies? Are there any medications, previous injury, illness, last oral intake, events leading up to it? So while we're gathering this information, we want to do this head-to-toe evaluation, finding is there somewhere they are painful? Is there somewhere it feels like there's an extra joint? Is there something that doesn't feel symmetrical, right leg to left leg, right side of the pelvis to the left side of the pelvis, the right side of the ribs to the left side of the ribs? Check that all the way through. So as you're going through this and are considering the different things in first aid, this is basically your introduction for the course. Yes, this is course material. That definition of first aid, immediate and what? Temporary care until a more qualified person takes over, or an equally qualified person takes over. Because this is what we're doing as a first aider, the scope of a first aider, what a first aider should be doing. Because when we talk about legal actions and things like that, then it comes back to, are we doing what a prudent person would do? And a prudent person is someone with the same training. Are we acting appropriately? What's defined in that scope of practice? If we are, then we're going to be protected legally also. So think about that as you work through some of this information, and go back and do your readings in those introductory chapters. Look through that PowerPoint, because I have a lot of annotation in the PowerPoint that's provided, which pretty much matches so far what you've seen in the video.